Mr. Hensley, you got a $60 million one-time equity award. That's a lot of money.
Tonight, we're digging into something that touches nearly every American household: medical insurance. This episode isn't partisan, it's structural. We're going to look at rising premiums, high deductibles, claim denial percentages, prior authorization roadblocks, corporate profits, executive compensation, and whether the system is aligned toward patients or shareholders. Let's get into it. The cost of coverage. In 2025, the average annual premium for employer-sponsored family coverage hit nearly $27,000. Workers paid roughly $6,850 of that directly from their paychecks. For single coverage, the average premium was over $9,000. And on top of that, the average single deductible in employer plans was about $1,787. So even with insurance, families are paying premiums, thousands before coverage kicks in, copays, and coinsurance. Having insurance no longer guarantees financial protection the way it once did. Claim denials.
Why we stretch every penny and dime to buy health care just to have the claim denied when I actually need it. And that's what's wrong. That is what's wrong in this system. Mr. Hensley, you were just asked about the denial rates. I have a chart. I have a chart right here of the denial rates. Now, I don't know if you could see it, but United Healthcare Group, according to the Kaiser Family Foundation study, says your in-network denial rate is 33%. That's 33%. You just told my colleague that wasn't accurate. Are you saying the report is inaccurate? Or are you just not aware of what your denial rates are?
Representative, I think we are aware of our denial rates. I don't know the context of what you're showing me.
Okay, so you're not aware of the study. Okay.
Excuse me.
Well,
Mr.
what do you
Nelson,
think your
can
denial
put
rate
your
is?
mic
What do you think the
closer?
percentage is?
Yeah, we're having a hard time hearing. If you could pull your mic closer, and we'll give you an extra
Sorry?
10 seconds.
Okay.
What do you think your denial rate is?
Less than 2%.
Yeah, that's like wildly off from any numbers that I have seen. I want to enter into the record an LA Times article published in February 2025 that tells the story of Colleen Henderson and her 3-year-old toddler, who of course is insured by United Healthcare. They fought your company for 5 years to pay for specialty care, to treat their 3-year-old daughter's rare condition. She had a tumor in her bladder. The family ended up with $1 million in medical debt and was forced to declare bankruptcy because United Healthcare said treatments recommended by the doctors were unnecessary. Do you understand why the American people are not a fan of United Healthcare and big healthcare companies?
Now let's look at the numbers most people never see. According to Kaiser Family Foundation analysis of 2023 federal data on ACA marketplace plans, 19% of in-network claims were denied. That's nearly 1 in 5. Out-of-network claims, 37% denied. More than 1 in 3. Insurers argue some denials are billing errors or eligibility issues. But when denial rates approach 20%, that's not rare. That's systematic friction. Prior authorization. Now let's talk about prior authorization, where your doctor recommends care, but your insurer must approve it first. In Medicare Advantage plans in 2024, 7.7% of prior authorization requests were denied. Only about 11.5% of those denials were appealed. But of the appeals, 80.7% were overturned. If you fight it, you often win. So the obvious question becomes, how many people never appeal? A report from the HHS Office of Inspector General found among denied prior authorization requests, 13% met Medicare coverage rules. Among denied payment requests, 18% met coverage and billing rules. Some people were denied care they were entitled to under the rules. That's not a political statement, that's a federal audit finding. Deny first, reconsider later. A study of Medicare Advantage plans claims found 17% of initial claims were denied, but 57% of those denials were eventually overturned. This suggests denial is often the first step, not the final answer. And when you deny first, you create friction. Some patients fight, some don't. And every denial not appealed reduces payouts. Corporate profits. Now let's talk about profit. In 2023, United Health Group reported roughly $22 billion with a B in net income. Elevance Health reported about $6 billion. Cigna reported over $5 billion. CVS Health reported more than $8 billion. That's profit after expenses. Insurers will correctly point out that margins are typically 3 to 6%. Medical loss ratio rules require 80 to 85% of premiums go to medical care. They are regulated entities. All true. But billions in profit alongside high denial rates creates understandable public tension. Executive compensation. Now layer executive pay on top. At United Health Group, CEO Stephen Hemsley reportedly received a $1 million base salary, plus a one-time $60 million equity award. Former CEO Andrew Whitty's compensation was reported at about $26.3 million. At CVS Health, CEO Karen Lynch's compensation was reported at roughly $21.6 million. At Cigna, CEO David Cordani earned about $21 million. When patients are arguing over an $800 imaging bill, those numbers raise questions. The incentive structure. Here's the structural issue. Most major insurers are publicly traded corporations. Their legal duty is to maximize shareholder value. That means premium revenue comes in, medical payments go out. Profit is the difference. Quarterly earnings focus on medical loss ratio, cost management, utilization trends, earnings per share, and shareholder return. What you don't hear earnings calls on is how many patients felt heard. Was care delayed? Did the denial cause harm? This doesn't mean companies are malicious. Okay, they are. It means the structure prioritizes financial performance. And in healthcare, cost control often means more prior authorization, more documentation, more review layers, more friction. When your fiduciary duty is to shareholders, not patients, tension is built into the system. Practical advice. If you're denied, get the denial in writing. Request the specific reason code. Ask for peer-to-peer review. Appeal. Because data shows appeals frequently succeed. Denied does not always mean final. Americans are paying more than ever for coverage. Denial rates are significant. Appeals frequently overturn decisions. Profits are large. Executive compensation is substantial. And the system structured around shareholder performance. This isn't about eliminating insurance. It's about understanding incentives. Because when healthcare functions as a publicly traded product, patients can feel like line items. And that's where the trust erodes. Thanks for watching Left Coast News and Behind the Line podcast. Please like, share, and follow us for more stories about the left coast and the United States in general. You can find us on all your favorite social media: YouTube, Rumble, BitChute, Brighteon, Spotify, Patreon, Facebook, Instagram, X, Truth Social, Substack, and TikTok. Visit our websites at leftcoastnews.net or behindthelinepodcast.com for more information. And please comment below. I'd like to hear genuinely what you think about the medical insurance situation in this country. Personally, I feel that anything medical related should be nonprofit. Hospitals, insurance companies, they should not be basing your health care on what they're going to make or their bottom line. Tell me what you think.
It's 11:59 at Radio Free America, and this is Uncle Sam with music and the truth until dawn. Right now, I got a few words for some of our brothers and sisters in the occupied zone. The chair is against the wall. The chair is against the wall. John has a long mustache. John has a long mustache. It's 12 o'clock, Americans, another day closer to victory. And for all of you out there on or behind the lines, this is your song.